Yeah, it's very true because to create so many isolation beds to actually get the test done and to wait for the report and then we should then decide whether to be positive or positive, which the designated hospitals can take over that patient. But as far as UP government is concerned, the home quarantine and home isolation facility is still not open, and only the patient needs to be isolated first before getting the sample to be taken off. And there are very limited
No, Dr.
number of
Kanika, my question is with regards and contextually to the Delhi order that has come in. So just just a blanket statement, patients, whether they're here, whether they're in Haryana, whether they're in UP, patients are patients at the end of the day. If they have mild to moderate symptoms, is it okay or not for them to be treated at home?
See, if they have an isolation facility in which they can keep a separate room or they can keep a separate washroom or they can at least have a distance between more than 2 meters into the family, very short, small family, then obviously definitely it is a very good solution that they have to be, should be home quarantine and the sample has to be taken from their home facility only. Till the report comes out, which takes about 24 to 48 hours max. So I definitely feel because it is a better option because that is much more convenient for the patient and for the obviously for the hospitals and for the government also.
Would you also say that there is a fair bit of fear in case this mandatory quarantine in a government facility order is executed, that people may just feel shy of getting themselves even tested, fearing that they might just be quarantined in a government facility for 5 whole days, Dr. Kanika?
Yeah, definitely. So the 50%, more than 50% of patients who have been recommended for these COVID tests, they are not even undergoing all those tests because they don't want to be quarantined in the hospital, in the government quarantine facilities. They would prefer it to be done in their home facilities. So mask that actually masks the COVID effect, where how many patients are still asymptomatic or mild symptoms are already existing in the society. So this is something home isolation facility is given. So obviously it will help the hospital and the government to know the next line of protocol will be followed. It's for the mild patient, what is to be done, and for the moderate patient, what is that has to be done.
Absolutely.
Yeah.
Absolutely. Dr. Hemant Thakkar of Breach Candy Hospital also now joins us on this particular story. Dr. Hemant Thakkar is somebody who has seen some amazing results when it comes to COVID patients, just like Dr. Prateet Samdhani, who was joining us as well. Dr. Thakkar, in your practice, when you're working on the COVID positive patients as well, do you feel that the ones who have mild to moderate symptoms do not need any kind of hospitalization or any kind of quarantine facility in case they have a space at home to isolate themselves? Dr. Thakkar, what's your opinion?
I entirely agree with you because in Maharashtra we've been following these guidelines which make absolute sense. That if patients are asymptomatic or they are mildly symptomatic and they have enough place to quarantine themselves where they have their own room and their bathroom and they are educated enough or made to be educated about the need for this strict quarantine, you don't need to hospitalize them. That way we have found that in the last 4 to 5 days, the run for beds in the hospital in Mumbai has slowed down. In fact, last 2-3 days, we've been seeing our casualties phoning to say, sir, we have a few extra beds. And I also know that KVM Hospital, where one of my colleagues is in administration, also has extra beds. So now 3 things have happened. Patients have confidence in being treated at home. Doctors have confidence in treating patients at home. And all this is resulting from the fact that there's a proper policy where monitoring at home with oxygen saturation, with fever and other things are being meticulously done. So that way you will reduce the load on hospitals, healthcare facilities will not be overwhelmed. And this panic where patients say, oh, I'm positive, and as if the sword which was hanging over their heads is going to fall, that never happened. So I think one has to take a pragmatic...
But this particular order that has come out, Dr. Thakkar, by the Ministry of Home Affairs, does it somewhere overburden the existing healthcare infrastructure, frontline workers, medical assistants? So it's not like when you're getting a person who has even got mild symptom, you're just not going to allow him to stay in bed alone. You will need to attend to that patient as well. So somewhere when you have limited number of healthcare workers in this country, shouldn't they be safe for the critical patients?
Not only will there be a burden on healthcare workers, but we will need PPE kits for them. We will need other isolation measures for them. But having said that, one has to logic that the health ministry or the home ministry has employed. See, Delhi is a separate situation. Delhi is like a hotbed where things are going out of control. If you suspect that you are not able to enforce the civil discipline that emanates from COVID quarantine, then you might have to take these measures. Because if you tell people to quarantine at home, to look after themselves at home, and if you're not sure that they are going to enforce this discipline, then there is a leak, and then you start having community transmission. So if the Ministry of Health or the Home Affairs Ministry has this in mind, then there may be a method in their madness. One has to see why they have done this. Because there are two kinds of people, the obedient kind and definitely the ones with gay abandon. The young people do not want to quarantine when we tell them it is not only for their sake, but it is for the sake of the elders who live in the house. Because it is they who bring the COVID home and give it to the elders who are diligently and religiously sitting in the house.
Right.
And who succumbs? The elders. So we have to be very...
No, that's a very, very interesting standpoint and an observation as well. Both the sides and both the sides of the argument very well justified and highlighted by Dr. Hemant Thakkar, Dr. Kanika and Dr. Prateek Samdhani. Appreciate you all joining us on this broadcast.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.